according to the Gates Foundation, the maternal mortality rate is higher here than in any other developed country. And the elimination of federal protection for abortion rights only underscores that reality and the risks ahead. Dr. Henning Tiemeier is the director of the Maternal Health Task Force at Harvard University, and he joins us now. Good morning to you, Doctor.
Hello, Margaret, and good morning.
Good morning. I think this is incredibly important because I want to put the issue of abortion itself aside for a moment and talk about pregnancy in America as these states rewrite these laws. So how is it possible that in the richest country in the world, we have the highest maternal mortality rate? And how do we stop it from getting worse?
Well, I have to say two things to that. First of all, there seems to be an issue with the data. We think it's higher than in other developed countries, so it is higher. But some of the uptick we've seen recently is partly due to poor data collection. So that has been corrected, but it is higher. So why is it higher? We think that has to do with the general health of women in America. So it is a background risk, and it is partly due to poverty, to poor health care during pregnancy, and importantly, poor care after pregnancy, after delivery.
The mortality rate among black mothers is 3 times higher than white women. Why?
That is correct. It is much higher. It is substantially higher. And it is, you must understand that there's about 700 women dying during or after labor or in the first months after delivering, 700 per year. And we know that most of these deaths are preventable. And they indeed occur in minorities more often, and in particular in black women. And why that is essentially one of the biggest challenges of public health. And we see that as the top of the iceberg of poor health in women and poor health in black women. And there are several reasons. There seems to go from poverty to discrimination to poor care for this group of women.
So according to the CDC, nearly 40% of all abortions performed in this country happen among black women. So in laying out what you did, I would base the assumption that you are projecting that the death rate for these mothers will also climb?
I don't think we have good projections in numbers at the moment, because that will depend on many of the issues actually that you touched on before, on the legal issues, on the access to abortion in other states. But we know that abortion occurs in people of poverty and in minorities much more often. We know that they have difficulties to access abortion outside the state, so we think it will impact their physical and mental health. How many deaths? Nobody knows. It is very hard. I wouldn't want to quantify that. No. I couldn't put a number. It depends on so many other things. Yes.
So, we looked at Medicaid coverage in this country. It covers about 40% of all births in the country. And the federal government is trying to get states to take more money to extend maternal health care. So it's not just cut off at 2 months, but it goes for longer. So women can get pelvic exams and they can get other things after they give birth. States like Mississippi aren't doing that. What's the consequence if you don't have access to health care after 2 months?
So what you're pointing out now is one of the big issues and one of the things that could be addressed quickly. There are numerous states, Mississippi is one of them, but don't forget Texas is another one, and that counts in big numbers, that have not expanded, as we say, Medicaid. They have not accepted the Affordable Care Act offer to expand health care to women in the first year. And I would actually say it should go further than that, in the first year after delivery. That means that you have very little right and very little coverage. So only the very, very poor in these states are covered, but a big number of poor women, of relatively poor, low-income women, women that struggle to make the time and the money to be insured, are not covered for things like mental health, physical checkups, even so they will not have the pelvic examinations that are needed. You're right.
So America looks a lot different now than it did in 1973. Brookings says about 40% of U.S. households have women as the prime breadwinner. So I want to ask you how important it is in your view, from a medical perspective, that women be able to take recovery time after childbirth? Because, of course, as you know, in this country, there is no federal guarantee of paid family leave. So if these women have to work to support their family, their job's in question, essentially, or at least being paid for it.
I think this is such an important issue. It's, in a way, under-recognized. I know that the Vice President addressed some of this, but it is very important to see that we need many measures to improve maternal health. One of them would be to improve the prenatal care, and the other is indeed to improve postnatal care, but also to support families. And it is in particular poor, disadvantaged families, buying them time. So giving them leave, paid leave, is very important, because having a child is a stress on the system. Imagine you have 3 children, you have a fourth one, then you need, you're making a minimum loan, you will not manage to make your ends meet. You will not find the time to breastfeed. We see that breastfeeding is not going up as we wished it would because of this. So I argue, yes, and many of my colleagues, that we need time. Yes.
And we will continue to cover your research. Thank you. We'll cover those issues on this program as well. I have to leave it there, though, so we'll be back in a moment.